on.
It's just random tokens.
Oh, I know what's wrong. I know what's wrong. There we go. Okay, let's take care of that. And I not press that button. Everyone did.
Oh, it's streaming?
Yeah, it's on. Check if it's on, and then we check the audio.
Does that work?
Let's see.
It's up.
Okay, it is
I
on.
don't know.
It is on. Good.
But let me check the
New microphone system.
30 seconds.
What? Okay.
Works.
Give up.
Shoe. That was my process.
Shoe.
Look.
We've already tested, so she's gonna grab it right now.
Oh, yeah.
You up? I'm just gonna scream into it.
Oh, there we go. It worked.
I tapped it and you could hear it.
Yeah.
Okay.
Hello.
Wow.
Even shoe.
I think it's good.
Already tested, so she's gonna grab it right now.
This is weird. This is reliving what we just talked about.
Deja vu.
It is deja vu. Okay.
Okay, let me ask him what he wants. Alec, would you like this clipped, or would you like it hung around your neck? The microphone.
I don't know, like here, right?
Yeah, closer to your neck the better, but yeah, that works too.
It's magnetic.
No way. What do you mean it's magnetic?
One of them goes underneath.
No, it doesn't.
With that?
Oh, got it.
Yeah.
Cool.
Clip that, we'll keep the audio.
How are you? Good, how are you?
I just need to get rid of this thing somehow. Yeah, that's close. Okay.
Bubba, can you hold her so she's not like running?
Once again.
Once again? And then keep running.
Grab your foil.
That's the big.
Gosh darn it.
We used to get
Alright. Part of it is cut off, huh?
Can you change the projection somehow?
No. It's just like this. I mean, I can do it, it'll show up, but...
Yeah, I know. How much?
So, yeah.
Oh, there we go.
Oh, okay.
Presenter mode. Yes, this will work. Maybe.
It should register. It's trying to catch it. We're just working. Oh, here we go. So,
Okay.
let me see if we can like shift.
Can you see? No. Laser pointer. Oh, geez. It's like way off.
Keep it on. Do the slideshow again.
It's the smaller one. Not the big one. Inside. Not the big one.
Okay, like what's? Oh yeah, now that.
Oh, nice. Keep going. Yeah. You're good. Yeah, perfect. Yay. All right, my coffee.
Can you make sure the stream is working before we start?
Oh, yeah. Should we turn off the lights?
These,
Or,
I think.
yeah, these ones here. This, it's together. Oh, okay. Yeah, that's all right.
Yeah, audio's good.
You see? Okay.
Whenever you're ready.
Well, just bear with me. All right.
Ready?
Yes.
Thank you everyone for coming. Alec,
Thank you.
ready for the blood pressure portion of what we started last year. I don't know if you all remember. You can go back and watch it. We have it saved. Thank you, Dr. Fallopian, for
Yes.
gracing us with your presence.
Thank you so much.
So take it away.
Hi, hello. So, whatever I say is truthful. I am board certified cardiologist. I've taken tests. I'm still in debt paying my medical school. So, and if you have any questions, I have no problem answering them and giving you a firm answer. I will not say things like, go talk to your doctor, okay? I will give you an answer, okay? I promise you. Okay. So, we're going to talk about pressure, blood pressure. Everybody has blood pressure at some point, right? So, it's something that's very common. I'm going to go over anatomy first, okay? I want you to follow my laser pointer. So, this is all related to blood pressure. So, what is blood pressure? So, your heart is here, right? And the heart is a muscle, just like your biceps. It's a muscle. And it pumps blood, okay, out to this red part. So then it goes to your brain, and it goes to other parts of your body, okay? And then your body takes the oxygen from the blood. The blood that doesn't have as much oxygen is the blue, comes back into the right side of your heart, goes to your lungs, gets the oxygen, and comes back to the heart. This happens over and over again, right? So blood pressure is the pressure in the red. Okay? You see all this red here? All this red. That is what the blood pressure cuff is measuring. The pressure in this red area. Blood pressure allows the blood to be pushed to the areas it needs to go. So you need blood pressure. Okay? Here's how the blood travels. Down your arm, right? Now, what happens if you have too low blood pressure? That's bad, because the blood may not have enough pressure to go down your arm or to go down to your kidneys. Okay? Your organs can't function if your blood pressure is too low. So too low is bad. Now, what about too high blood pressure? That's bad too. Why is that bad? So this is a zoomed in picture of a blood vessel. Okay? And the blood pressure is the pressure that is exerted onto the walls of the blood vessel. Okay? So if you have very high blood pressure, it's like someone pushing really hard against the blood vessel walls. And that can cause damage to the walls of the blood vessels. And where do you have blood vessels? You have blood vessels in your brain. You have blood vessels in your eye. You have blood vessels in your heart. You have blood vessels in your kidneys. So if you're pushing really hard against these blood vessels, okay, you're going to get damage to the blood vessels in your brain and cause a stroke. You're going to get damage to the blood vessels in the heart and cause an area that could also get a heart attack from blockage in your heart blood vessels. You can also cause damage to your kidneys. Permanent damage to your kidneys. Okay? This is why blood pressure is so important, because if it's too high, you can cause permanent damage. Stroke, you can't move your arm. Heart attack, you have shortness of breath and chest pain. Kidneys, you need dialysis. Okay? These are the extreme examples, but I'm just giving you examples. This is why blood pressure is so important. Okay. Here is a picture of a brain saying help, because it's getting too high of blood pressure and it can cause a stroke. The heart attack, and the kidneys, kidney damage. I'm just putting these as the main organs that the blood pressure, if it's too high, can affect. Okay, so how do we check the blood pressure? With the blood pressure cuff. How does the blood pressure cuff work? The blood pressure cuff squeezes air onto the blood vessel to the point where it squeezes and you have no blood flow in that area. Okay? And then you release the air little by little, and finally what happens is the pressure that is being exerted onto the blood vessel wall is similar to the blood pressure inside the blood vessel pushing the blood vessel open. Okay? So at that point, we call that the systolic blood pressure, which is the highest blood pressure in the blood vessel. Okay? That's the systolic blood pressure. And then you release the air more and more and more till the blood is flowing smoothly. And at that point, at that pressure point, the air pressure that is pushing down against the blood vessel and the blood vessel is pushing against the air, that is the diastolic blood pressure, the lower blood pressure, the bottom number. That's the number where the blood flow is flowing smoothly. No problems, okay? The diastolic blood pressure. You guys are familiar with this, right? So the top number is the systolic blood pressure, where the pressure is the highest, pushing against the air on the cuff. The lower one is the diastolic blood pressure, and that is when the blood vessels are a bit more relaxed, but still some pressure against it, okay? All right, so the systolic is the highest pressure, diastolic is the lowest blood pressure in the blood vessel. These are the definitions of blood pressure based on the systolic blood pressure and the diastolic blood pressure. So normal is the green, less than 120 over 80. Elevated is 120 to 129 over less than 80. Stage 1, high blood pressure, is 130 to 139. Or a diastolic blood pressure of 80 to 89, and stage 2 is as such. Okay? This is how we've defined high blood pressure. And I'm going to tell you why we've chosen these numbers. These are not arbitrary numbers. Okay? These are very important numbers. There's also an even higher blood pressure, and this is when you can get a very bad stroke. Okay? If you have a blood pressure of more than 180, okay, you can get a stroke. Very important. You can have a blood pressure of 180 at home, don't worry, and you won't get a stroke. But the reason why we do worry about it is because you can get a stroke, okay? All right. If you want to treat blood pressure, you need to know how to check blood pressure. Very important, and you'll see why. You need to sit like this. The back of your back against the back of the chair. Feet flat on the ground. Okay? Feet flat on the ground. Legs uncrossed. Okay? Arm is bare, meaning your shirt cannot be underneath the cuff. Okay? Because if you have more things here between the cuff and your skin, you're increasing the amount of pressure that your blood vessel experiences, and the blood pressure cuff is not calibrated for that. So it will measure the blood pressure too high when it is not that high. Arm needs to be at your heart level. Okay? If your arm is lower, your blood pressure will be higher. If your arm is higher, your blood pressure will measure lower. Okay? So it needs to be at the level of the heart. You need to have the correct cuff size. You should empty your bladder. Çişik betkeniz. Okay? Before you get your blood pressure checked. And you need to rest quietly for 5 minutes. Oh, and this is why. If your legs are crossed, your blood pressure goes up by 2 to 8 points. If your cuff is over your clothing, it can go up to more than 50 points. Cuff is too small. This is my favorite. If your bladder is full, it goes up by 10 points. If you're talking to all the people who like to talk a lot, okay, and you're getting your blood pressure done, it can go up by 10 points. Okay? So this is all evidence-based. Okay? This is why it's very important when you go to the doctor's office, you need to check your blood pressure in an appropriate way. If you don't, your doctor is going to overdiagnose you with high blood pressure, and they're going to say you need to take medications when you may not need medications. Okay? So this is very important. You need to vouch for yourself.
The bladder one, is it because you said kidney is one of the organs that receive most blood?
It is not. It's purely because of what you would think commonly. If you're constipated, if your bladder is full, you're kind of tense.
Oh, okay. It's very simple.
That's it.
Okay.
You're just more tense. Your sympathetic nervous system is activated. Yeah, that's why. It's a stressor to your body. Okay, this is the goal blood pressure. The American College of Cardiology, ACC, American Heart Association, AHA, the American Stroke Association, American Diabetes Association, they have set these as the United States of America guidelines. I will be honest with you, I don't like these guidelines. I like the European ones much better because it's more simple and it's to the point. This is too complicated. We make things too complicated in the United States. Europeans make it much more simple. Okay? So, the definition of what your blood pressure should be is based on these guidelines. Okay? If your risk of having a heart attack or stroke in 10 years is less than 10% based on a formula that's been created, and I'll show you that formula, then your blood pressure goal is this. Okay? If your risk of having a heart attack or a stroke is more than 10% in 10 years, based on this formula that we use, your goal should be this. Okay? If you have diabetes, this is your goal. If you have kidney disease, this is your goal. If you have a stroke history or a stroke-like symptom, this is your goal. Very complicated. You know what the Europeans say? Your goal is less than 140 over 80. That's it. That's what the Europeans say.
It covers all of it.
It covers all this. Okay? But we are too complicated. And this is based on evidence. You know, I put all the articles here that I'm referencing, okay? Everything has a reason behind it. These guys have chosen their reasons based on articles that they've reviewed. Okay? So, I just wanted to show you something. I may need your help. I need the pointer. I have a link here, Jonathan. How do I...
Dr. Alec?
Yeah.
So you go by European then? You're okay with that?
I predominantly go by European. I usually do not go by US guidelines unless you've had a stroke. If you've had a stroke, I use this. If you haven't had a stroke, I go by European guidelines.
So age and sex doesn't matter?
It does matter. So I did say the European guidelines are more simple, but they do have a caveat of as you get older, you have a bit more leeway. Because as we get older, our blood vessels become stiffer. It's like wear and tear. Just like the tires wear, our blood vessels wear as we get older, and they become calcified and stiffer. And when they become stiffer, your blood pressure goes up a little bit more. So as you age, there's some leniency in the blood pressure goal, okay? But generally, okay, less than 140 over 80, no matter what age you are, is a good goal, okay? It's a good goal. But if you're, let's say, 54 years old, okay, your blood pressure goal, I would say, is less than 140 over 90 if you have no issues. If you're 80 years old and your blood pressure is 150 over 80, I'm okay with that as long as you don't have any major stroke history or even a heart attack. Then I would say probably less than 140 over 80. But if you're a healthy 74-year-old, 150 over something is okay to live with. Okay?
One more question.
Yeah.
Sometimes when you go to the doctor's office and the diastolic is it's like kind of low, but it seems like maybe it's not as big of a deal as the upper number. Is that?
You'll learn. I will teach you that in the next slide or so. Okay? I'm just trying to, Jonathan, I don't know how do I get I just want to click on this link. Do you know how to do that?
Get out of the laser pointer to turn off the laser pointer.
Turn off the laser pointer.
And then click.
Oh.
Cannot open.
Oh, okay. Well, whatever. It's fine. I was going to show you how we calculate the risk score. Okay? The risk score is based on your age, your cholesterol, your blood pressure, and white, your race, right? Or African American, Asian. And it also depends on whether you take blood pressure medication or not. The older you are, the higher the score. The higher your blood pressure, the higher your score. The higher your cholesterol, the higher your score. Okay? So they have a scoring system that we have. Okay? All right. All right. Why do we care about blood pressure? Because we want to reduce stroke, heart attack, heart failure. We want to make you live longer, and we want to prevent kidney damage. And this will answer your question, Samuel. This was a study done in 1967. Who was born before 1967? Okay. Do you know about this study? No? I didn't know about it until recently. Okay? It's a very old study, but it's a very good study. Okay? Just because it's old doesn't mean it's bad, right? Okay. So, what did they do here? Okay? They wanted to know if I give you a sugar pill or if I give you a blood pressure medication, will you, number one, have less likelihood of a stroke, less likelihood of a heart attack, or less likelihood of aortic dissection? Do you know what aortic dissection is? It's when your blood vessel, your big one, tears open. Okay? Albert Einstein died of that. Okay? So it's testing whether a sugar pill versus a blood pressure medication will prevent these things from happening. Okay? And they looked at patients who had a diastolic blood pressure, Samuel, the lower number, between 115 to 129 on average. Okay? That's very high. 115 to 129 was the bottom number, okay, in this population. So they gave sugar pill to some, and the others they gave blood pressure medication. And what happened? I just put this up there as a reference so we know what number we're talking about. The placebo group, the sugar pill group, versus the active treatment group. There were 4 deaths in the placebo, the sugar pill group, no deaths in the blood pressure treatment group. Class A events are events that I described: aortic dissection, stroke, or heart attack. There were 10 of these events in the sugar pill group, 0 events in the blood pressure medication group. Class B events were non-terminating events, meaning that they didn't cause some sort of life-ending event. Okay? It may have harmed your body somehow, but it didn't debilitate you. Okay? These events related to your cardiovascular system were 21. Okay? Sorry. Yeah, 21 versus 1. Okay? No, sorry. 6 versus 1. The terminating events, the ones that may have killed you or made you debilitated, were 21 versus 1. Okay? So, 27 patients had debilitating or non-debilitating cardiovascular problems if you had a blood pressure this high and you were given a sugar pill. If you were given a blood pressure medication to bring down that blood pressure, you only had 2 events. The reason why this study was done in 1967 and we can't do this anymore is because I can't tell you that I'm going to give you a sugar pill if your blood pressure is that high, because you will sue me because I am deliberately giving you something that will not make you better and may cause you harm. Okay? So there's no way legally we can do this study in the United States of America anymore. That's why old studies are great studies, because we didn't know enough information then, and so we did things that were dangerous. Okay? And we've learned from these dangers. You guys understand that? Okay. Does that answer your question, Samuel?
Yeah.
Yes.
Over what duration of time was this study?
It was a short period of time because they ended the study prematurely. I don't know how long it was. I think it was at least a month or more, a little bit more.
Bad things happened in a month?
Bad things happened within a month. Yep. So it was definitely less than a year. Okay, they had to end the study prematurely because they found so many events. They said, we can't do this study anymore. We stopped. Yeah. Okay? Let me see my notes. I might have put it in my notes. Okay, I'm sorry. I lied to you. Okay? They assessed blood pressures and events up to 24 months. I just lied to you. I apologize. So 24 months. Justin, I'm sorry.
Alan, can I follow up
Yeah.
on his question? So what's more dangerous, a high diastolic or a high systolic?
Very good question. High systolic. Okay? But high diastolic, I put the study purposefully to show you that a high diastolic is also dangerous. Okay? The ballpark I'll give you is if your diastolic is less than 100, you're okay. If it's more than 100, that's dangerous. Okay? Yeah.
We've been talking a lot about, it seems like the high end, the top end. Are there numbers on the low end that we should be concerned about?
Yes. So we as a medical community have a cutoff of 90. But it's a more complicated question to answer because we don't only look at the top number when we're assessing for low blood pressure. We look at the mean arterial pressure, which by mathematical formula is the top number plus 2 times the bottom number divided by 3. Okay? If that number is low, which a low number would be somewhere in the 50s, okay, less than 60, that's not good. Okay? So even if that top number is in the 80s, it might be okay, even though that's considered to be low, as long as that mean pressure is good. Okay?
I asked because I once had a nurse take my blood pressure in the morning. They didn't like the top number. They said it was gave me some water to change it. It changed, and then they were happy about it.
Yeah.
So I was a little confused about.
The reason for the low blood pressure concern is because of this image that I told you. Okay, where if you have too low blood pressure, it's bad because you're not having enough blood flow going down to your organs or your extremities, to your brain. The most important is your brain. That's why we pass out. If you see someone standing for a long time in a choir singing and all of a sudden pass out, it's because they don't have enough pressure going to their brain. And so then when the body's very smart, God made very smart bodies. You pass out because if you pass out, gravity can no longer push the blood down. When you're laying down, gravity is not pushing blood down anymore. Okay? So the blood can flow much better to the brain. Does that make sense? So that's why we pass out. Because the body does better when you're laying flat. Okay? All right. All right, so what about the top number? I told you about the Europeans, and I like the Europeans, okay? So the Europeans did a very famous study in 1997, okay? This was after I was born, okay? So what did they do? Sugar pill versus blood pressure medication in the 1990s, okay? Again. What did they, and this was the baseline blood pressure of the group that they studied, so very high, okay? Placebo versus active in 2,297 patients in one group. This was a study of 5,000 patients versus this study, which was of less than 50 or so patients, okay? Huge study, 5,000 patients. They're giving half of them sugar pill, half of them blood pressure medications. When their blood pressure is very high. Okay? And then they follow them. Okay? Justin, how long do they follow them for? 4 years. Okay? They follow them for 4 years. And they look at stroke and heart failure and heart attacks. And what do they find? They find it's a negative here because they find that you have less, strokes in the blood pressure group. 5.7 versus 10.1. Okay? It's a percentage. Okay? And then in the cardiac event groups, heart failure and heart attack, there's also less in the blood pressure group. Okay? So if you take a blood pressure pill, your risk of a heart attack, heart failure, and stroke was less if your blood pressure on average was this. Okay? Now these are non-fatal. What about fatal? What if these killed you? Okay? Even the ones that could kill you, were much less in the blood pressure treatment group versus the sugar pill group. Okay? So if your blood pressure is this high, in 4 years you could die of stroke or a heart issue. Okay? Yeah. In 1997, I guess, however they did the study, you can't sue them. But now, if you did the study, you would sue them. Okay? We can't do this anymore. Okay? So your blood pressure being this high can lead to those issues. Now, what was the average age of this group? That's important, right? 70. The average age of this group was 70 years old. So you had 50-year-olds, 60-year-olds, 70-year-olds, 80-year-olds, but the average age was 70. Okay? So whoever in this group here is within the 60 to 80 range, if you have this high blood pressure, you better control it because you're going to get a stroke or a heart problem in 4 years. Okay? All right. Look at all these studies. 1998, 2000, 2002, 2002, 2003, 2004, 2002. There were so many more studies done to say, is blood pressure treatment with medications better to prevent bad things from happening? And all these studies showed that. But they didn't use sugar pills. You can't use sugar pills anymore, okay? Because it's just, people will sue you. You know that the blood pressure medications work to save lives. You can't deliberately use sugar pills, okay? I love this study, okay? This study took 42 randomized controlled trials, okay? These are the best studies that we could do. And they looked for whether you die from a heart problem depending on what your blood pressure is, okay? And they looked at stroke, heart failure, and MI. And I put a question mark here because it didn't specifically say stroke, heart failure, MI, but it made it seem as though when they mentioned cardiovascular disease, that's what they were talking about. But they weren't very clear. They used different medications, and the studies ranged from 1970 to 2015. 42 studies they looked at. And what did they show? If your blood pressure right now is 150 to 154 and you bring it down to the 120s, you favor lower blood pressure, meaning you will live longer. Okay? If you bring it from 155 to 159 to the 120s, you live longer. 160s or more to 120s, you live longer. 150s to 130s, you live longer. 160s to 130s, you live longer. 160s to 140s, you live longer. However, if you brought your blood pressure from the 150s to the 140s, they did not show that you live longer for the whole group. It tended towards living longer, but the statistics weren't significant enough to say you're going to live longer. The ones in red, they found that you will live longer if you bring your blood pressure down from those top numbers to the other numbers. Does that make sense? Okay? What I'm trying to show you is you can save lives, okay, by bringing down your blood pressure. This is why doctors have a job, to save lives by doing these kind of things. Okay?
I have a question. However, this is showing that you're living longer, but reducing from 150 to 140.
Yeah.
Can we still say that you're still protecting the kidneys?
Not in this study. In this study, they did not look at that.
They're just looking living longer.
That's correct.
Okay, but there's still a benefit, no matter what your blood pressure is, to bring it down.
Theoretically, yes. It depends.
Disease.
Correct.
Right.
Yeah. Yeah. I don't know. I can't say definitely if you bring your blood pressure from 150 to 140, is your kidney disease progression going to be less? Is it going to be better for your kidney? There might be a study out there. I just don't know of it. Maybe. Yeah. Yeah.
Pulse numbers, they don't have any effect?
The heart rate, the pulse? Not as much as blood pressure. Yeah. The pulse is not as important. You need it, but it's not as important as blood pressure.
Is it true that every heart has a certain number, like 20,000 heartbeats?
No, that's a bunch of baloney. No, that's not true. Because you can develop a heart problem at any point in your life. So that's not true, whoever told you that. All right. Look at this, okay? So I'm just pointing out that if you reduce your blood pressure by just 5 millimeters of mercury from 160 to the 150s, you can reduce your risk of cardiovascular disease. That is major. So what is the definition of major cardiovascular disease? Heart attack, stroke, okay? But these are but in a non-debilitating way, not killing you, you know? Okay? All right. Why did I put this up? Because remember what I said. If your bladder is full, okay, and you get your blood pressure checked, your blood pressure will go up by 10 points. Okay? So, but don't worry. Just because it goes up by 10 points doesn't mean you're going to get a stroke or something. But the doctor is going to say, oh my gosh, it's so high. Look at these studies. They said that I need to reduce the blood pressure. If I reduce from 160 to 150, I can prevent bad things from happening. So they're going to say, you need to take a blood pressure medication.
I have a question.
Yeah.
How about those medications? Are they harming the body also? The kidney or other things?
Certain ones can.
People,
Yeah.
they have itching, they have this and
Yeah. You have, so here's the thing. When someone is pointing a gun at you, okay, you're afraid that your life is going to end, right? Your life is very important. So you don't care about your car. You don't care about how much money you have on you that day. You don't care about these little things. I don't care if I have a rash. I don't care if my eye looks puffy. I don't care if I have lipstick on. All I care about is this guy going to kill me or not, right? So this is how doctors look at patients as well. If I don't give them a blood pressure medication, are they going to die in the next 4, 5, 10, 6 years? Are they going to have a major heart attack, stroke? Are they going to have kidney disease and be on dialysis? So we look at patients like that, which is why we are okay with giving them blood pressure medications, even though there is a risk, which is much smaller risk, of a rash or some other little thing that can happen. That's how you have to look at it. Okay? All right. What do we do to help? Okay, actually I put this slide here for a reason. What causes high blood pressure? Do you guys know?
Smoking, number one.
Smoking. Okay, good.
Smoking,
Let's see if this will work.
diabetes.
Smoking. Diabetes. What'd you say?
Obesity.
Okay. So overweight, we'll say. What else?
Lifestyle.
What do you mean by that?
Stress.
Stress?
Stress.
No. There was actually a study that they went into an office, I think it was in Britain, and they looked at patients, they looked at the participants who were stressed versus not stressed. And they had a questionnaire to figure out how stressed they were. And they compared their blood pressures, and there was no significant difference. So stress did not cause their blood pressure to go up.
So that's a European study.
However, in the clinical, in what we experience when we talk to patients and people, family member passes away, or they have other stresses in their life, their blood pressure is usually higher. Okay? But if I want to quote you a study, I cannot quote you a study that says high stress causes high blood pressure.
What about exercise?
Exercise to increase blood pressure or decrease blood pressure?
So lack of exercise.
Okay. So it's indirectly will help because if you exercise, you can lose weight. And if you lose weight, your blood pressure gets better. And the rule is if you lose, according to a study, which I'm going to mention, if you lose 11 pounds, your blood pressure goes down by 5 points. Okay? What else?
salt.
Wait, I'm talking about things that can, yes, salt. Who said that? Yes, salt. Salt. And I'm going to show you a study about that. What else?
Lack of sleep.
I don't know, but that sounds right. So there's a field in medicine called chronobiology, okay, where they look at that. If you don't sleep well, or if you eat late at night, do bad things happen to you? And there is general consensus that that is the case, even though I do that as well.
So like the lack of sleep is connected to higher cortisol levels, right, in the morning, which
Yeah.
can raise blood pressure indirectly.
Correct. Cortisol can increase your blood pressure.
So that's how maybe the sleep is connected, the lack of sleep.
I don't know. Maybe. I don't know.
We see
That's a field. That's a field of its own called chronobiology, and I'm not an expert in chronobiology, but it's certainly possible what you mentioned. Yeah. I'm honest. I tell you what I know. I tell you what I don't know, and I don't know chronobiology field well. Okay. What else? What if you snore at night? What? Sleep apnea.
Genetics?
Genetics, probably, but we haven't found a gene. But probably. Okay, I think we did pretty good with this. But there's also other medical things that can cause it. It's called, what we say, secondary hypertension. Okay? So if your body produces too much cortisol, if your body produces too much aldosterone, which is a hormone, if your body produces too much renin, if your blood vessels in your kidneys are too small, these are things that are medical issues that cause high blood pressure. Okay? It's my job to figure out why you have high blood pressure and then fix it. Okay? Good. How do we treat it? There is no non-medication option.
Sugar pill.
Non-medication option versus medication option. Okay? Weight loss. Big time. Meta-analysis of 25 studies from 1966 to 2002 showed that if you lose 11 pounds by restricting calorie intake, exercise, or both, your blood pressure drops by this much. That answers your question about exercise. Okay?
So would that be every 11 pounds, another 10, another 5 more?
It may be that if you lose more, it might be exponential. I don't know if it's cumulative by adding 5 plus 5. It might be 5 times 3. I don't know. You might lose like 15. You might drop the blood pressure by 15 points. Yeah, but this study showed if you lose 11 pounds, if you lose more, you will definitely lose your blood pressure will go down more. I just don't know how much. What about diet? Who said salt? Listen. Low to intermediate salt, which is defined as 1,150 to 2,300 milligrams a day, okay, is that. So I'll go over what's high salt, okay? That's low to intermediate salt. So if you take in this much salt, you're okay, all right? DASH diet, the dietary approach to stop hypertension. That's what DASH stands for, not Kim Kardashian, okay? It's dietary approaches to stop hypertension. That's what it stands for. And this diet is high in fiber, fruits, vegetables, whole grains, nuts, poultry, and fish. Low in saturated fat, red meat, and sweets. New England Journal of Medicine study. That's where I'm from. I'm from the East Coast. This is a very prominent study in 2001. I love this study. It was an amazing study. Listen to this study. They took people and they gave them the American diet. Eat whatever you want. Pancakes, hot dogs, hamburgers, eggs with salt, eggs with, basturma, anything, sujuk, everything. Eat whatever you want for 2 weeks, okay? For 2 weeks. And then they said, okay, this group of people, we're going to put them in the DASH diet. The other group of people, we're going to put them in the control diet, okay? The control diet is still the American diet, but they say low sodium group, intermediate sodium group, and higher. So they split them up into 3 different groups in the American diet. And then the DASH diet people, they also split into 3 different groups. Does that make sense? Do you want me to say that again? Does that make sense? American diet for 2 weeks. Anything you want. Then you either go into the DASH diet group or you continue the American diet group, but you continue the American diet with either low sodium, intermediate sodium, or high sodium. Okay? And you do that for 30 days. And then, the DASH diet is high fiber, fruits, vegetables, whole grains, nuts, poultry, fish, low fat, no red meat, not much red meat, and low sweets. The details I'm not mentioning because it's too overwhelming to know the exact numbers of what, but this is the general idea. Okay? This is the DASH diet right here. Okay? It's essentially a Mediterranean diet. Okay, hummus, tabbouleh, all that, DASH diet. Okay? So, what did they find? And they're checking the blood pressure. Okay, they checked the blood pressure multiple times in this period during the 2 weeks and in this period during the 30 days. What do we find? Now we're looking at salt here. Okay, salt. Oh, I put this for Justin. Okay, this is what the American diet is right here. One of these is equal to 1,900 milligrams of sodium. Just one. Okay? It's ramen, but the spicy one. Okay, so look at this. What do we find? So, follow my arrows, okay? This is a graph. On the bottom of the graph is the salt intake. High, intermediate, or low. High is the definition right here. 3,450 milligrams per day. Intermediate is 2,300. Low is as such. In the control diet, if you took a high sodium intake, your blood pressure was higher. I understand, and this is your blood pressure. Now, your blood pressure wasn't that high here, but you have to remember, in this study, what I didn't mention to you, let me just tell you, hold on one second. Participants were assigned to... I'm pretty sure these guys were healthy. Yeah, these were healthy patients, okay? That's why their blood pressures were low to start with, okay? So if you're a healthy person with a reasonable blood pressure to begin with, if you have a high salt diet, and then you reduce your salt to only this much, your blood pressure will drop from the 133 to like 126. Okay? And if you were, see this blue arrow? If you started out in the control diet group, the American diet with high salt, and then you still kept the high salt intake, but you went to the DASH diet, okay? Then your blood pressure drops by 6 points, okay, in that 30-day period. Similarly, if you were in the intermediate salt group and you were eating an American diet, if you then stopped eating the American diet and you ate a DASH diet, your blood pressure would drop by 5 points. You're just dropping your blood pressure by changing the way you eat, okay? So, what does this study tell us? It tells us if you follow the green line, if you reduce your salt intake, your blood pressure will go down. If you reduce the intake of certain foods, okay, in the American diet, like eating less red meat, eating less saturated fat, like less butter, less lebni, okay, your blood pressure will get better. Okay? Does that make sense? It's an amazing study. It basically summarizes why we do what we do. Why do we eat healthy? This is why. This study is amazing. It's telling us you're dropping your blood pressure. Okay? All right. Does that answer your question about the salt? So, if you're eating, so here's what I take from this. If you're eating 2,300 milligrams or less of salt, that's fine. Okay? You're okay. If you're eating more than that, your risk of having high blood pressure is higher. Okay? Okay? All right, and this is the DASH diet here. I can't go into detail, we don't have time. Yes?
Does it matter when you consume salt? Does it matter if I consume it at the beginning of the day versus the end of the day? Does that even make sense what I'm saying?
So I'll answer your question with an example. I have a patient whose blood pressure drops at nighttime, very low. And she gets dizzy. She hates it. So what do I tell her to do? I tell her to take a pinch of salt. I tell her to put salt at your bedside. Take a pinch of salt and eat it. And she feels perfectly fine. I'm answering your question with that example because salt intake can immediately affect your blood pressure. So I don't care when you take the salt, morning, evening, whatever, it's going to affect your blood pressure.
Okay, interesting. Anecdotally, so a lot of us wear rings. I've noticed that when I eat salt later in the day, my ring will not fit the morning after. But it's specific to when I eat it. And that could be me just kind of coming to that conclusion without really looking at it further, but that's why I asked.
Yeah. It takes time for swelling to happen, as opposed to the immediate blood pressure effect. Okay, Mediterranean diet. Okay, what's the difference between the Mediterranean diet and the DASH diet? Similar, yeah, that's basically what it is. It's like 2 to 3 times more oils in the Mediterranean diet. That's the main difference. Okay? Good job. You must be Mediterranean. Okay, so this is the Mediterranean diet here. 4 tablespoons or more of oils. Nuts, fruits, vegetables, legumes. Sofrito, you know what sofrito is? Sofrito is tomato sauce based something. Like tomato sauce with onions, what do you call it? Saute. You saute it, okay? That's sofrito. Apparently Mediterraneans do that a lot. So they put it in the diet, okay? And this is a low-fat diet. And I put this up here because there was a study that compared these two. And this is what the study showed. If you eat a Mediterranean diet, high in EV is extra virgin olive oil, and then nuts is nuts, okay? And they compared these groups, Mediterranean diet with a high nut intake, Mediterranean diet with a high extra virgin olive oil intake, to the controlled diet, which is this low-fat diet, okay? And what do they find? That systolic blood pressure, the top number blood pressure they checked for 24 hours with a cuff that checks your blood pressure 24 hours. They found that there was a reduction in the blood pressure at the end of the study, which was the 24-hour period, of 3 millimeters of mercury versus the 2 millimeters of mercury, and then there was an increase in blood pressure in the control group. Okay? So that is another study that showed Mediterranean diet can reduce your blood pressure. It didn't reduce it by that much, but compared to a regular diet, a low-fat regular diet, which is high in calories, like a lot of bread and chips and things like that, versus the Mediterranean diet. The Mediterranean diet had a lower blood pressure. The control diet had a higher blood pressure. Okay? Supplements. Oh my gosh, this is a little out of whack. But okay. Fish oil. Just follow me, okay? 2 to 3 grams a day of fish oil. That's a lot of fish oil. If you go get the Kirkland brand fish oil, that's like 4 capsules a day. That's a lot. All right? That's a lot of fish oil to take. Now, this study showed if you take fish oil, so this bottom is the grams per day of fish oil, DHA and EPA, and this is the blood pressure, okay? The blood pressure initially drops if you take between 2 to 3 grams. Okay, that's why I put 2 to 3 here. If you look at this graph between 2 to 3, you get the lowest blood pressure effect, or the greatest blood pressure effect. If you take more and more and more fish oil, your blood pressure actually goes up, they found. So you have to be careful how much fish oil you take, but 2 to 3 grams is safe. But honestly, it's hard to do that because there's too many capsules. What about hawthorn berry? This study looked at 1,200 milligrams a day or 6 grams of the dried flower, like in a tea. Sugar pills versus hawthorn tea. The diastolic blood pressure went down significantly in both groups, but more significantly in the hawthorn berry group. And the systolic blood pressure went down as well in the hawthorn berry group and did not in the sugar pill group at 6 weeks. Okay? So this worked. I cannot recommend this to you. Please don't take this just because I'm saying this. It has side effects like nausea, GI upset, diarrhea. If you want to try it, you can try the hawthorn berry tree, but I'm warning you, there are some issues people develop from it, okay? And your blood pressure can drop precipitously, so just be careful, okay? I've had a patient whose blood pressure dropped pretty significantly with hawthorn berry tea. Okay. I just put that up there. Oh, what about aged garlic, okay? 1.2 grams of a powdered supplement. This is what the study showed. Follow my highlights. Blood pressure here, mean systolic blood pressure. And along this side is a number of weeks. And these are the different groups that they studied. People who took in garlic, okay, had a lower blood pressure by almost 10 points at 4 weeks. If you were a garlic responder, meaning some patients, 29 of them out of the 50, were garlic responders, meaning they were more sensitive to the garlic response. But there was also a group that didn't respond at all to the garlic. So just because you take the garlic doesn't mean your blood pressure is going to go down. Okay? You might be in the population that it doesn't change at all. Okay?
So it varies.
Huh?
It varies.
It varies. Yeah. For you, it might drop it. For me, it won't do anything. Okay? Coffee is not good. Makes it go up. Okay. Blood pressure medications. There are 13 different classes of blood pressure medications that doctors can choose from to give patients. The top 3 are the following. Okay? You have to choose the medication based on what we think it will help with and not harm. Okay? As Takuhi mentioned. We don't want your kidneys to be harmed. Based on your age, certain blood pressure medications are better than others. Based on your access to getting blood tests, certain medications are better than others. And based on how high your blood pressure is, certain medications are better than others. Weight loss will help your blood pressure, no matter what you do. If you take Ozempic, if you do bariatric surgery, your blood pressure will get better. If you do a therapy that we offer at our hospital that not many people offer, where we put a catheter inside the blood vessel of your kidney, and what we call burn a nerve in your kidney, blood vessels, your blood pressure can also get better. Okay? These are not for regular folk. This is for people who have very bad poorly controlled blood pressure. Remember this. That's it. Any questions? Incha Meghur? I have not read that. No. Meghur, I have not read that causes high blood pressure. But it can, yeah. Meghur is fine. Yeah. Anything in moderation. Yeah. Anything else? Yeah. Yeah. Welche. Specific questions, ask me later. Like about you. But this is just for group, yeah.
Thoughts about beets?
I didn't include it. I should have included it. I like beets. I like the beet vitamins. Yeah, I've seen patients' blood pressures get better with it sometimes. Sometimes it doesn't. Sometimes they have more energy. There's good studies about beets. But I didn't find any excellent studies on beets like these ones. That's why I didn't include it. But these have excellent support behind them. That's why I included it. Yeah.
Just in short, Nazaret mentioned honey, but are there any non-prescription, non-medication things that would help in the long run?
Yeah.
Bring blood pressure down. You talked about beets, but any other?
The hawthorn berry tea.
Oh, that
Yeah.
would be better. Okay.
Garlic. Yeah. And if you don't want to buy the garlic pill, some of my patients have actually taken garlic cloves, smushed it, put it in boiling water, and drink it like tea. And they have had lower blood pressures, anecdotally. I haven't seen in studies about it, but yeah. And they boil it, and put it in your tea.
Boil it first, smash it, put it in tea.
Yeah.
Like tea.
Yeah, you don't have to smash it too much, just a little bit. Put it in your tea. And put it in the boiling water, let it sit for a bit, a few minutes, and then drink it. I haven't seen any studies about ginger causing lowered blood pressure.
Those Hartone berries, are they capsules or?
You can get them in capsules, you can get them in teas. Yeah.
Wouldn't just, we wouldn't even have to put garlic, like boil it and put it in tea. It would, like Sister Armenian, a diet already contains salt, so wouldn't that just be helpful in general?
I don't know. I haven't seen any studies about it. Because, yes, your reasoning is appropriate. You're using logic. And based on your logic, you can extrapolate that if garlic is helpful, then in a pill form, and in my patient's experience in the tea form, it should be helpful in the salad, it should be helpful in whatever you're doing, right? I just don't know. I haven't sought that out. I haven't asked my patients, right? However, as you can see with the Mediterranean diet, which has a lot of garlic in it, blood pressure is better. And, I can't say it's because of the garlic, but, that's the best answer I can give you. Yeah. Cinnamon. I don't know of any studies that are good that say cinnamon can lower your blood pressure. But you have to be very careful with cinnamon, okay? There is a lot of powdered cinnamon that has lead in it. And even the good brands, okay? I have it in my phone of the brands that don't have much. But if you are going to get cinnamon and you're going to use cinnamon, it's better to get the sticks, okay? Because the machines that they use to grind it, for whatever reason, lead leaks into it, the powder. And so you get lead in that's why I don't give my kids cinnamon powder, because I'm afraid that they'll get exposed to the lead. And there was a major issue in the US where there were pouches sold at Aldi's where the pouches had cinnamon in them. They're baby pouches that you give kids, like yogurt pouches, and they got lead poisoning because of the cinnamon from South America that packaged those pouches. Yeah. That's it?
Okay. Thank you
Okay.
very much. As usual, thank you, Alec.
Thank you.
Sophie's coming. She's any questions you have?
Yeah, any individual questions I'm happy to answer.
Perfect.
Okay.
Stick around, and then we'll gently move next door, and we'll start our English service. You're more than welcome to join us if you'd like.
Thank you, Jonathan. Thank you. Yeah. No, I didn't even. I forgot it was there.
Right?
Yeah.
Good. Okay. Good. Perfect. What's up?
What I'm hearing is if I eat a bunch of garlic with the salty salad,
You'll win.
cancels it out.
You'll win.
You'll win.
Hey. How you doing? Surviving.
Coughing outside the house.